Hello, everyone. Welcome back. In this video lecture, we're going to be reviewing Chapter 15, covering procedures on the skin. Please have your code books handy along with your textbooks so you can reference the tables that we talk about during this video lecture. And again, we're covering these PCS procedures related to the skin, not only the skin, but the breast, subcutaneous tissue, and fascia. Again, keep your textbook open to chapter 15 because we'll be referencing specific tables in your book. And you may want to also keep your code book handy as we work our way through the specific tables. And again, these tables that you can find in your code books are tables 0H0 through 0HX for the skin and the breast codes. And what this covers is the root operations that you see in table 15.1 in your text. This could be alteration, change, destruction, division, drainage, and so on, right? Remember that PCS coding is based on the objective of the procedure, not the procedure name documented by the provider. And they could be two very, very different things. And again, once you go to table 0H0, fourth character is going to be describing the body part. So then you only have four characters after you get to the correct table. And again, body part is the fourth character. This could be skin of the scalp, skin of the face, and so on, as mentioned here and also in table 15.2 in your text. This slide begins with skin, and then it covers skin of all the different areas, including the abdomen, buttock, and perineum. Perineum, excuse me. PCS requires very little specific anatomical identification, so documentation requires the exact site. So it gets very, very specific. We just can't say skin or what have you in most cases. And again, here's more on the skin, inguinal, right upper arm, right lower arm, and so on. Notice how it just doesn't say arm. We also have laterality, left, right. And again, we could also, in addition to having skin, we could have skin of the arms, upper arms. We also have lower legs, feet. Not only that, we have fingernails, toenails, hair, and breast structures. Notice the breast procedures are included with the skin procedures in PCS, and we have laterality for the breast body part selection. The fifth character identifies the approach to reach the skin or the breast. Refer to table 15.3. Most skin procedures, however, are coded with the external approach, but open or percutaneous approaches may apply depending on the procedure performed. So if they're going to get the subcutaneous tissue, fascia, what have you, then it would not be external, it would be open. Our sixth character identifies a device if one's used and left behind. And you can see these on this slide and also in table 15.4 in your text. This could be tissue expanders, autologous tissue substitutes, synthetic substitutes, radioactive elements, and so on. Any temporary instrument that's used during surgery are not coded as devices. Remember, it's the device that remains behind after the procedure is finished. Now, the seventh character is a qualifier. The qualifiers we've seen before gives us additional attributes or details about a procedure. And table 15.5 shows them along with the slide here. And this could be things like whether a skin graft is full thickness, partial thickness, different flap techniques, cell suspension technique, and so on. We always have no qualifier as an option, and we would use the no qualifier when it's supported by the documentation. So If there is no qualifier, we don't just assume that one was used. Now we're going to talk about the skin, beyond the skin, and cover subcutaneous tissue and fascia. And this is located in tables 0J0 through 0JX, subcutaneous tissue and fascia procedures. And some of the root operations that we see are the same ones we've seen earlier: alteration, change, destruction. If you're confused on what the root operation is, think about what the intent of the procedure is. In other words, what were they trying to do? The fourth character is the body part, and it, like the skin, it starts with subcutaneous tissue and fascia, scalp, subcutaneous tissue and fascia, face, etc. And these are mentioned on this slide and also in table 15.7 in your textbook. And you can see more of them here: right upper arm, left upper arm, very similar to what we saw earlier with the skin itself. Again, right foot, left foot, and so on. The fifth character identifies the approach that's used. And again, the approach that's used could be open, could be percutaneous or external. And you can review those in table 15.8. And again, the approach isn't what is done, more so it's how the provider reaches the operative site. So if a procedure is being done on fascia, on the skin, it could very well be external. It could also be percutaneous or open if it's getting to the site itself, the deep fascia and what have you. So you have to read the op report carefully. The sixth character identifies the device, and you can see them listed here. You can also see them listed on table 15.9. And again, if no device is left, the correct value is going to be Z for no device. And again, you can see more of these devices. Could be a stimulator, generator, rechargeable, synthetic substitute, and so on. And again, table 15.10 talks about the possible qualifiers, right? So qualifiers for this could be skin, subcutaneous tissue, diagnostic, or no qualifiers we've seen before. When we talk about excisions and resections of skin, it can get a little bit confusing. So with excision of a skin lesion, the therapeutic purpose is to remove a diseased lesion, right? If we're doing a biopsy, right, it's a diagnostic procedure. Whether it's therapeutic or whether it's diagnostic, in this case, it's still an excision after the B in table 0HB. With the resection, we're removing something entirely. So we're completely removing a finger or toenail, what have you, breast nipple, and so on, right? And that would be from table 0HT, right? So excision versus resection. Resections do not apply to skin and fascia, as it's not possible to cut out or off without replacement all of the body part of skin or subcutaneous tissue. If you think about it, it makes sense. Skin grafting procedures are coded using the root operation replacement because we're replacing burnt skin, right? And we could use some sort of synthetic skin supplement, right? We could use, if it's going to reinforce something, if we put an infusion pump or vascular access devices, it would be an insertion. Now let's talk a little bit about excisional debridements. Debridement involves removing devitalized or contaminated tissue. If we're excisional debridement, if it's an excision, uses the root operation excision when the provider documents cutting away tissue. And this is something we see sometimes in nursing home patients involving cutting away the subcutaneous tissue and fascia found in tables 0HB or 0JB tables, right? A non-excisional debridement is different. It's coded using the root operation extraction because tissue is pulled away or stripped away rather than cut. And these procedures are performed at the bedside usually and are coded with tables 0HD for the skin and 0JD for subcutaneous tissue and fascia. And that's all I have for you. Thank you for watching, and please reach out if you have any questions about this material. That's all I have. Bye now.